Hi, my name is Peter Tomasovic, and I've been a nurse for the past 20 years. The first 15 years were in a nephrology department, and the last 5 years were in a post-anesthesia care unit. The very first couple of years that I worked, like I said, was in an outpatient clinic, dialysis clinics, and this is where I got my first exposure to the mental health care professionals. Patient care plan meetings that we would have about once a month. The doctor, a nurse, a dietitian, a social worker would be there. So it would always intrigue me to hear what the social worker has to say about a particular individual, especially if they're dealing with some mental health care problems. I will add so much depth and almost a different dimension in understanding what this individual is dealing with. And that was very meaningful for me. After graduating with my bachelor's, I got my MBA in healthcare administration. This was also a cohort program, a 3-year program. It was live 2 days a week, 3 semesters every year. It was quite challenging and grueling, but I did it. So yes, I can handle the workload. I've done it before. The most important thing is to have my wife backing me up, and she is. She's excited about this opportunity as well. As far as the leadership challenges goes, I work in a post-anesthesia care unit. As I mentioned, I'm a charge nurse. I enjoy taking the responsibilities and troubleshooting issues, helping, advocating for my patients, their family members, and my coworkers as well. One of the examples I want to share with you is having a patient with a severe PTSD, a veteran of Afghanistan war. He has a history of waking up very violent after the general anesthesia. So I was approached by the head of the anesthesia, Dr. Itkin, who wanted to restrain this patient and do all different kinds of things. And I said, hold on, let's just see how this goes. So I went, I thought about this. I was like, let me introduce myself to this patient. Knocked on the door, introduced myself, talked to him, his wife, his kid. I like making little jokes. I said, this is the face you're going to see. I'm sorry about that. There's nothing I can do about this. There's nothing I can do about my accent, but I can promise you they'll give you the best possible care and you're going to be okay. I promise you that. Well, fast forward after the surgery, he's waking up, he's clenching his fist, he's keeping his eyes closed, very, very tense, and I'm holding his hands and I'm talking to him and reassuring him, and eventually he wakes up a little bit more, he takes a sip of water, I'll give him some pain medication, he relaxes, and he says, thank you. I was like, yeah, no problem, sir. That's what I do. He says, no, Peter, thank you for introducing yourself. I did recognize your voice. That made a difference for me. And I was like, wow. That is one of the examples why I am a nurse and why I want to learn more so I can help more, so I can understand, diagnose, treat patients. YUT program, I think you guys have a great program, top 20. Small cohort, something that I'm used to. I think it's a great fit for me. So thank you for this opportunity. Thank you for considering my application. Then have a good day.